Early estimates are that more than 2,000 elective and other procedures have been scrapped this week because of the junior doctors' strike. Members of the Resident Doctors Association are into their second day of a 5-day strike over their expired employment agreement. In Parliament today, the Health Minister David Clark once again refused to step into the dispute. But doctors on the picket line say the government's involvement is now absolutely critical. Joanna Mackenzie reports.
On day 2 of the strike, Dr Clark was asked in Parliament about the impact it's having on patients. He says hospitals are reporting no unexpected issues and people are still turning up for work.
Approximately 38% of house officers and 72% of registrars have made themselves available for work this week, and DHBs are advising the public that if they need to attend hospital for acute or emergency medical treatment, they should do so.
Dr Clark says while precise figures won't be known for some time, he had an early indication of how many procedures had been deferred.
I am advised that preliminary planning estimates are that 1,513 elective procedures and 776 other procedures, such as elective angiography, have been deferred. People are missing out on planned care as a result of the strike, and that's why I'm urging both DHBs and the RDA to make the most of facilitation.
Stand up, fight back!
But members of the Resident Doctors Association on a picket line at Auckland City Hospital today say the Minister must step in. Dr Maple Go, who works at Middlemore Hospital, says Dr Clark's response to doctors picketing his office yesterday was a huge letdown.
He put out a really disappointing poster that said that he was disappointed with the doctors, which is huge hypocrisy considering we're disappointed with him that he hasn't stepped in at all. And it should be in his power to make the DHB sort this out. We've been trying to sort this out for 12 months now, and it's just appalling that David Clark has been sitting on his hands.
Vice President of the RDA, Dr Catherine Foster, says the government got involved in other contract disputes, so why not this one? She says the strike is important because the doctors don't want hospital chief executives to have the final say over working arrangements.
The problem with the CEOs having the final say is we're a vulnerable population. We're dependent on the DHBs for our training and for our capacity to continue to learn and work. If we let the DHBs have final say, we have no recourse over changes that may be damaging to our lives in training and our lives outside of the hospital. We can't then go to a different employer. We're a captive audience.
Dr Foster says part of the issue lies with a lack of trust between the doctors and the DHBs, and that's been a problem for a long time.
We've had many years of a systematic erosion of trust, and it comes from our side, from the DHBs, saying one thing and doing another, and that's why the protection of our union is so important and why we're so desperate to hold on to it, is because we can't trust the DHB.
The doctors on the picket line say support from the public and their senior colleagues remains strong. Meanwhile, the DHB spokesperson, Dr Peter Bramley, says the strike is unreasonable and unnecessary because facilitation talks are due to start on May the 9th. For Checkpoint, called Joanna Mackenzie.